Hi, this is Christy Brewer with Aspen Valley Senior Homes. I'm also the co-author of the book and workbook Home to Home, a Senior Planning Guide. In a previous video, I talked about the 3 levels of senior living, and they are independent living, assisted living, and skilled nursing care. And today, I am going to focus on just skilled nursing and give you some little bit more information into what that kind of facility will look like. If you have my book or workbook, there are questions in here that will help you ask different facilities when you're calling. Hopefully you are able to plan ahead and it's not a crisis situation. Sometimes people will go to skilled nursing facilities from the hospital because they need rehab to get them back to where they're back to their baseline, to where they can go home or go to a lower level of care. So if that's the case, sometimes you're not ready and you don't really know what's out there. So if you take the questions that are in the book or the workbook, or I also made a video with those questions, if you take those questions and start planning ahead and looking at these different skilled nursing facilities, then when the time comes and there is a crisis or something happens, then you or your loved one has a list and is like, here's a few facilities that if I have to go, whether short-term or long-term, this would be my top choice, 1, 2, 3, and what's even available at the time that you need it. You know, these facilities are probably, I would think, the hardest to choose because they require the most hands-on care for your loved one or for yourself. So you really have to be particular, and when you do tours and phone calls, and making sure that you really feel at home, because it's so important, and I've said it before, that you just need to feel safe, you need to feel respected, and you really need to feel loved whenever you're moving into any different senior setting where there's going to be caregivers involved. So what is a skilled nursing facility? Well, it is just what it says. It's a skilled nursing, which means you need medical care. So 24/7, it is staffed by nurses, both registered nurses, RNs, licensed practical nurses, LPNs, certified nurse aides, certified med techs, and then often it will have all of the therapies included that you can receive when you've come from the hospital, or if you're having a decline in function while you're a long-term resident there. Therapy will jump in and help out to get you back to that baseline to be the best you can be. This would be the most restrictive of the 3 levels of care, and that's because you tend to need more than the assisted living. You know, maybe one person needs to help you get to the bathroom. Well, you've moved to the skilled nursing because you may need 2 people to help you move to the bathroom, or you may require your muscles just aren't working like you'd like them to, and you may require like a Hoyer lift or something to get you transferred from your bed to the chair. You may need more help feeding yourself, and you may need a special diet because you're having problems chewing and swallowing, and you want to be able to be safe and still maintain all that nutrition. So some of the things that are also provided in these skilled nursing facilities, I'm going to read here from page 126 in my book, would be personal care. So it will include all of your housekeeping, laundry, meals, and bathing. They'll monitor your medical signs, so you'll be having your vitals taken. Management of a patient's care plan. They'll constantly be observing your medical condition. You may have tube feedings. You may need rehab. They will often provide dental services. A dentist usually comes in and is not on staff, and they'll provide recreational activities. So they'll have bingo and music and arts and crafts, and even community events where you'll take trips out in the bus and do different activities out in the community, or even just take a ride, see the beautiful fall leaves. So most treatments are provided by in-staff people, but they may have services that are brought in from outside that aren't permanent members, like I mentioned, like the dental, or even some of their therapists. Maybe they have in-house physical therapy, but occupational therapy and speech therapy is contracted in as needed. So let's see, I think I may have covered everything. Well, so what I do want you to really know that's important, not every skilled nursing facility is going to offer the same services. So it's really important to ask what you need, what you want, and whether they provide that or not. Some services that homes might offer and others might not would be things like dialysis. Some will offer IV drug therapy. Some will offer specialization in Alzheimer's and dementia patients. So you just want to make sure you're checking and asking the questions and using those questions that I mentioned that are in my book or workbook or on the video will be really helpful in getting you started to find the right spot, because you want to feel at home. It's a hard move, and I don't envy anyone that has to do it, but you want to feel like you're in the right place and you want to feel loved and respected, and everybody deserves that. So please reach out if you have any questions. I wish you luck on this journey, and I hope you have a blessed day. Thanks.